Most drivers don't know how long to block out for a DOT physical. They show up guessing. That uncertainty adds stress to something that's already on your mind, and stress before a blood pressure reading is the last thing you need. Here's the real answer. For most commercial drivers, a DOT physical runs somewhere between 30 and 60 minutes. That's start to finish, paperwork included. But that window assumes you walk in prepared, show up missing documents, or with uncontrolled blood pressure, and that clock stretches out fast. So let's break down what actually happens in that room. You start with paperwork. The FMCSA Medical Examination Report form asks about your health history, current medications, any surgeries, and chronic conditions. Fill it out honestly and completely. Gaps or inaccuracies don't help you. They slow things down and can create problems with your certificate later. After the paperwork, the examiner goes through the physical evaluation. That means a vision check for distance and field of view, a hearing test, blood pressure and pulse, a urinalysis to screen for things like diabetes or kidney issues, and a head-to-toe physical, cardiovascular system, lungs, spine, abdomen, extremities, neurological function. The examiner is checking that you're fit to operate a commercial vehicle safely. The physical portion moves quickly when a driver comes in ready. Now, here's what slows things down. High blood pressure is probably the most common reason an exam runs long or requires a second visit. If your reading comes in elevated, the examiner may take multiple measurements or advise you to follow up with your own clinician before certification can move forward. Beyond blood pressure, drivers managing conditions like sleep apnea, diabetes, seizure disorders, or heart disease often need supporting documentation, a treatment summary, a specialist letter, something that shows the condition is being managed. If you show up without that paperwork, the examiner may not be able to certify you that day. That's an avoidable delay. A few things to bring every time: a full medication list with dosages, documentation for any ongoing conditions, your glasses or contacts if you use them to drive, and hearing aids if you wear them. And hold off on caffeine and hard physical activity before the appointment. Both can push your blood pressure reading higher than your normal baseline. One more thing worth clearing up. A DOT physical is not the same as your regular annual checkup. The DOT exam follows specific FMCSA guidelines, and it has to be performed by an examiner listed on the FMCSA National Registry. Your family doctor's physical doesn't substitute for it unless they're also on that registry. If you want to learn more or schedule an exam in the Modesto area, Modesto.com has the information you need before you walk in the door.